Yeah, good evening, everyone. Thanks for coming down for the press meet. Today, orthopedics is become a big and vast subject. The scope of orthopedics have increased quite extensively, and it is humanly not practical and possible for one orthopedic surgeon to specialize into all the fields, like right from trauma to tumors to spine to hand, pediatrics. It's not, because the scope of 20 years back, if suppose when I was doing my PG, if you ask how do you treat a fracture, we used to tell that we used to put a POP. But right now people don't accept that modality of treatment, and it is not fair for us to make the patient lie down in bed for 3 months. So the scope of orthopedic surgeries have increased extensively. To fulfill these demand, the concept of subspecialty has come up. So it's like now in Citizen Hospital we have divisions. Like I head the Musculoskeletal Oncology. I am a tumor surgeon, and complex surgeries, like failed surgeries, the failed orthopedic surgeries, like once or twice they get operated, again it fails, then I do the surgeries. And I also do pelvic trauma. So these are something called and infections. These are something called salvage orthopedics, like where all things are exhausted and then they come to me. Similarly, Dr. Abhilash is a consultant in arthroscopy surgery. So arthroscopy is a keyhole surgery. Like he is very well trained in all the keyhole surgeries, like in the knee, in the shoulder, in the ankle, in the wrist. So he does quite extensive work in that. And similarly, Dr. Balraj is our joint replacement surgeon. He's extensively trained in robotic surgeries. What we foresee is the next, probably another 5 years, probably robotic surgery will come quite a bit into orthopedics. So we are looking into robotic surgeries, and not only computer navigation. Actually the V guiding, or the surgeon guiding, and the robots doing it. It is happening in onco surgeries now, but we are trying to extrapolate into orthopedics. So our understanding of orthopedics is quite high. So that is the reason that we are planning ahead of the times, and we are going into subspecialty. And also we have a spine surgeon. We have who does a lot of spine, just not discectomy and some deformity corrections, but big deformities like scoliosis or kyphosis corrections. We also have hand surgery and a pediatric surgery. So basically, this is a time I think we should head, and people should also start understanding that there is a need for subspecialty based practice, and a particular doctor is good in particular thing. It is humanly not practical to be good in each and everything. So I think that is the initiative that we have taken at Citizens, and that is what we are heading towards.